Endometriosis is a very common benign condition that develops when the lining of the uterus, the so-called endometrium, grows outside of the uterine cavity in other locations as close to the uterus as the tubes, the ovaries, the peritoneum, the bowel, or even the surface of the uterus and the bladder, and as remote as the lungs or even the brain. Patients with endometriosis have an inflammation in the pelvis, and that inflammation leads to the formation of adhesions or scar tissue that might immobilize the ovaries and the fallopian tubes, and it might interfere with the egg pickup mechanism of the fallopian tube from the ovary, and that way can cause infertility. Endometriosis can be diagnosed as early as the age of 10 or 12, even sometimes before a girl sees her first period, all the way up to the postmenopausal age, although after menopause and existing endometriosis gradually disappears. In many patients with endometriosis, the very first symptom of endometriosis is their inability to conceive, although they try for a long period of time. Other common symptoms are pain during the period, pain during intercourse, or pain during other times of the cycle. Sometimes the pain can be localized, which means in one certain location, or can be diffused, which can be present in the entire pelvic area. Patients with endometriosis produce a smaller number of eggs of lesser quality that have lower fertilization and pregnancy rates. It is also well known that patients with endometriosis are at higher risk of losing their pregnancy at the early stages of gestation. Endometriosis should be suspected in every patient with infertility, even if the patient has no symptoms. The physician that treats a patient with infertility should be aware and should look for possible signs and symptoms, and especially during the pelvic examination, to determine whether or not the patient might have endometriosis. However, clinically, it is impossible to make the diagnosis of endometriosis, and one has to resort to a procedure called laparoscopy, which is an operative procedure in order to make an accurate diagnosis of endometriosis. Laparoscopy is the golden standard, and it gives us the opportunity to treat the endometriosis at the same time of the diagnosis is made. If the endometriosis has caused adhesions, the adhesions are removed, the tubes and the ovaries are freed from their attachments to the pelvic peritoneum, and that can restore the normal anatomy and normal function of the tubes and the ovaries. Treatment of endometriosis can be very successful, and most of the patients, once the endometriosis is treated and they do not have any other problems that will prevent them from getting pregnant, they can conceive on their own, and most of the patients indeed conceive after treatment of endometriosis with or without minor help from us by stimulating their ovaries to produce a few more better quality eggs.